Okay, I think we'll get started. So welcome everyone. My name is Sheena Lee, and just to give you a little background about me, I work for MedPsych Associates. We are located in Bergen County, New Jersey, and I know some of you are from across the country, so welcome. I hope that what we talk about today is valuable to all of you. What we're going to be talking today about is autism. We are going to look at all the key features of autism, understand some of the core features that contribute to the diagnosis, and we will have some time for questions and answers too. So a little bit of housekeeping information first. I do encourage, as we go through, put your questions in the question and answer box, and we'll try to get to as many as we can at the end, but you can pop them in there as we go throughout the presentation. Now, we do care a lot about confidentiality, and I know some of my own families that I work with will be in here, so if you want to change your name before you answer or before you ask questions, please do so. You can do that. Now, I just want to give you a little bit of a background about me specifically. I'm practicing psychiatry in an outpatient psychiatric practice, which is MedPsych. I'm a physician assistant by training and certification, and I'm specialized in psychiatry. A lot of the work that I do is with children and families, and these children have autism, and their families need a lot of help and support. And so I wanted to kind of put this together so we can all work together and kind of understand what are some key things that we need to understand when we are, as clinicians and as parents, when we are working with people with autism. So another thing I wanted to say, just to start out before we get into the slides, is that I may go back and forth between using a person with autism or autistic, and I recognize that in the community there are quite a few different opinions and preferences about the terminology and how it's used. And so I do feel that it's most important to recognize the person themselves as what they want to be called. If they wish to be called autistic, that is what how I will refer to them. In this presentation, I may use either or, and hopefully you understand why. So let's get back into the slides here. Okay. So we call this Unraveling Autism because autism is so many things, and we need to pick it apart a little bit to understand what it's about. You know, as I think most of us who have experienced autism in one way or another, no two people are the same. And so MedPsych Associates, just a little blurb about us before we get into it. We, as I mentioned, we provide psychiatry services. We also provide psychotherapy. We provide a real comprehensive gamut of testing, especially for autism and ADHD. And we do specialize in children and adolescents, but see plenty of adults too. And we are located in Ramsey, Ultapan, and Montclair, New Jersey. So today, some of the things we'll be talking about, we're going to talk about the definition of autism. We're going to recognize the early signs of it, and we are going to consider some communication challenges that occur, and also what it means to embrace neurodiversity. So according to the DSM-5, right, this is our diagnostic manual in which kind of defines what the disorders in mental health are. And this is kind of the main reference, and this is where we look at what criteria are needed to fulfill a diagnosis. And if any of you understand the history of autism and how it came to be what it is today in terms of diagnosis, you will understand that there have been so many changes. The DSM has changed quite a bit, especially over the last 2 versions to give us the definition of autism that we have today. So here is the summary of that definition in the DSM-5 today. Autism spectrum disorder is a neurodevelopmental disorder characterized by a range of symptoms and impairments in social communication and interactions, but also has restricted and repetitive patterns of behavior, interests, and activities. There's so much packed in there. We'll get to break it down here shortly. The DSM also says that these symptoms typically appear in early childhood and can vary widely in severity, hence the word spectrum. So to start by kind of breaking this down a little bit, understanding that early childhood onset, which is so important to the diagnosis, we'll talk a little bit about the early signs that may come up. And if any of you are professionals and you are working with young children, you will know that there's quite a variety of different ways that children develop and what the development looks like, right? So it can be kind of hard to pick some of these things out, but when I'm evaluating a child for the first time and we are considering the question of autism, these are some of the things that will come up and often parents will have noticed in one way or another. Now, if we look at specifically what are social challenges, these social challenges can occur early on and they can persist all the way through adulthood. So some of the things we're looking at are the classic eye contact is probably one of the more well-known possibilities. So there can be limited eye contact or absent eye contact. However, this is not everyone, but it is something that is notable. We can also have different interests as far, this says difficulty, but I would say different interests in terms of what kind of social interactions the child or the adolescent would be interested in. So when they're very little, you may see that there's not a lot of back and forth, or the back and forth interaction may be limited. So this can look like that child is really not responding to their name being called. Sometimes this will come up in school. The teacher will call on them and it won't be, they won't see that there's clear, consistent response every time. Now, another social challenge, which may not really show up until later, or and may be very difficult to understand, is the use of nonverbal cues. And we're going to get into this stuff a little bit more as it goes on, but understanding facial expressions and gestures and body language, I think this is a really important thing to understand, because when we communicate, typically we're using body language and we're using facial expressions and gestures to communicate and emphasize and describe our feelings. You know, when we're talking, we use a lot of this stuff very subconsciously, and a person with autism or a child may not be able to pick those things up, or may even be confused, or not detect the severity of what you're saying. Now, there can be limited interest in forming relationships with peers. This is definitely not across the board or consistent, and sometimes it may look like they're not interested. However, it may be more that they don't know how to form these relationships with peers and adults. And, that's a very general summary. Certainly in practice, we see a lot more in terms of the social difficulties and the social challenges. And they can come up in terms of, not being able to maintain friendships and struggling with friendships. Sometimes bullying is involved, and there's a really wide gamut of social difficulties. So one of the first things that I assess where I'm hearing social challenges is, hey, what is going on? Give me specific examples so that we can understand what happened in that interaction and was there miscommunication. Now, communication difficulties sounds like what we were already talking about a little bit, but actually this is referring to how that child or adolescent is communicating. Now, a lot of times the big flag is delayed speech development and delayed language development. And so it's not uncommon that I hear, well, there was a major speech delay and we started speech therapy at age 12 months or 1 year. So that is a big flag. Of course, children develop at their own rates, but sometimes when you look back, you can consistently see this history. Interestingly, that's not always the case either. I think it's important to keep in mind that each one of these things that I'm outlining in this presentation today may be there, but may not be there. But I'm giving you things that may kind of fall under these categories that are required for the definition. So we have difficulty this type of speech and language development is often very characteristic of a young autistic child trying to develop their language. Now, we have also the possibility for just maybe they're speaking well, maybe they're conversing, but there's some difficulty understanding what is said. And sometimes this is kind of referring to what we call receptive language. And so they are having trouble understanding what is said and responding to questions appropriately. We spent a lot of time on that. But I think it's important because those are really key features that I think we don't always think about. Now, more obvious, right? Much more obvious are the repetitive behaviors. And this is what is like really classically understood, right? You see a child hand flapping, you see them rocking back and forth very often, or you see them spinning in circles. These kind of things happen on the outside of them, and it's very obvious to see, and that's a pretty clear flag. But this category may not always display itself in these outward behaviors. And I think this is sometimes where autism gets missed because professionals and even parents in their life don't recognize this type of thing happening. There can be an insistence on sameness and resistance to changes in the routines. Now, these situations can be one of the biggest reasons that I see kids coming in for psychiatry, because there can be a severe difficulty deviating from what they expect. And if parents cannot make it happen when they expect it to happen, there can be some significant emotional distress. So changes in routines especially can be distressing. A lot of times I think he has OCD and, he's doing the same thing every day. And certainly there's a lot of overlap, but this kind of need for routine and inability to deviate from it can definitely fall under this category. Now, you can have some pretty intense focus on the specific interests that they have. Now, this very different from the first two bullet points, but still falls under the same category, because here we're talking about more restricted interests. So they may have unusual interests. They may have very intense, I just have to focus on this thing. I just have to study this. I don't want to study anything else. And it is really to the exclusion of all other activities and topics. Sensory. let me go back. Sensory sensitivities. Okay, this is a big thing. And for quite a few children that I see, the sensory sensitivities that they have are significant, and they may be very sensitive to light. They may be very sensitive to sounds. And I think the sensitivities are a little bit more commonly recognized because you see the distress that they go through in when they encounter these stimuli. Tastes included in there, so this can really impact the food and the eating, and they can be very restricted in what they eat. Now, maybe less recognized is the sensory seeking, and some of this results in behaviors that appear unusual, or they appear socially inappropriate, or really just odd to the parents or the professionals, and they are actively looking for that sensory stimuli. So they may be really attracted to loud noises and really want that input, or sometimes the rocking and the spinning is sensory seeking in a way. And sometimes it's really tactile. They're, picking at things or feeling objects. And, really if you see them repeatedly engaging the senses in one way or another, most likely there's some sensory seeking. So recognizing the early signs, right? Sometimes it's better to think about this and give some examples, look at it a little bit more practically. Play is a big one. How are they playing? Are they engaging with toys in the typical way, or are they using the toys in an unusual way? So, very classically recognized as the lining up of toys, and they're not engaging in the typical play. They may not be using things imaginatively, and they may not do role playing. It may be more rote. It may be more like we're taking toys from a TV show or something, and then instead of it pretending we're the superhero, we're just lining them up and organizing them. So that's a pretty classic thing that a lot of people recognize. But sometimes it can look imaginative, and you have to be really aware of what their intention is with the toys. And then we also talk about lack of social reciprocity, difficulty understanding and responding to emotions, needs, and interests of others. Now, sometimes people will say, well, they have no empathy. So if they have empathy, they're not autistic. And that's just not what we're talking about here. They may understand the needs of others, but they may not be able to engage in a way that is, they're able to kind of bend and meet the needs of the others. So, and they may feel very bad about it. I definitely think this is missed a lot of times, because sometimes they know they can't help it. They do something, someone gets upset, and they feel really bad afterwards. Sometimes there's a limited expression of their own emotions. This, I think, comes out more in verbal, ability. If we don't have the language to express our emotions, we're not going to, right? So sometimes it's more that it can be difficult to recognize the emotions sometimes. This I feel is much easier to understand in an older person who is able to have that conversation and express that. But in children, you may see just reacting. You may see tantrums and whatnot. Or you may see sad or crying and you don't know why. So let's talk about play for a moment. This is we're not doing case examples here, but this is a picture of a child who loves to.
Hey, Sheena.
Yes.
So we're not able to see your screen.
Uh-oh.
Would you be able to back out and reshare your screen?
Yep.
Thank you. And I'll confirm that it's visible.
Can you see that?
I cannot.
Okay. Is it full screen?
It's not full screen, but it's workable.
How about that?
Wonderful. Thank you.
Okay. So yeah, we just did a quick review of, some key features, but we'll get into a little bit more of the examples here. So in play, so this is a good example of what you may see a child with autism doing. Again, the classic lining up of things, organizing. You could see that we have a nice line of papers, and the papers have characters on them. And, for this child, this was a very typical type of play. All right. So we'll get into the repetitive behaviors category a bit. Okay. I talked a bit before about movement specifically, what you see on the outside, right? Okay, rocking, hand flapping, finger flicking, this kind of thing is pretty classic and well understood. And we talked about, we may see some spinning, we may see spinning of objects. We have also falling under the repetitive behaviors, as we mentioned, the routines and the rituals, the need for sameness. One example that I give you here is the need to follow the same routine every single day and getting very upset with it. This could be anything. It could be in the morning, it could be at night, it could be how I go through my school day, it could be which teacher I have. And so the need for routine is extremely important. Getting upset is pretty common when these expectations are not met. And I wanted to get a little bit more into repetitive play. One of the classic things they teach us is that, well, when a child is playing with a car and they are spinning the wheel and they're just staring at the wheel spinning, that is a sign of autism. And I think I've heard that about 500 times. But it may not be so obvious. Some of that repetitive play might be, we're going through the same motion. Maybe we are imaginative in a way and we are carrying out a scene, but maybe we're carrying out the scene in the same way every time. Or maybe the parent has to say a particular thing a certain way, and if it's not said the exact way, they have to repeat it again. And if not said the right way, the child can get upset. So that's those are some examples of what you might see in play. You also may see a fixation on specific items where they get really attached to one toy or one aspect of the toy. And there's looking, staring at it, there's playing with it, looking at it from different angles, looking at it with different lighting. The point is here picking up really small details within the environment. Now, sometimes that ability to really focus in affects a number of areas in their life. And sometimes they can get really super focused on one particular topic. They may be able to memorize extensive facts about that, and they may be reading about it all the time. They may be immersing themselves really in it. And we have exclusion of other things during that time. You know, they may not want to eat, or they may not want to change the activity. And so a lot of times we hear difficulty with transitions, right? That there are many reasons for the difficulty with transitions, but sometimes this is an area where it shows up because their interest is so intense in that thing that they don't want to leave it, and it would actually feel painful to do so. But as a result of the intense focus, sometimes some of our kids will display a very impressive knowledge about certain specific areas of knowledge, which is very beyond what is typical for their age. This is not every child, though, and you know, I do kind of caution against categorizing certain children according to this feature. And what I mean by that is, you know, I hear a lot of, well, you know, this is they're more Asperger's like because they have this, because they're high functioning and they know all this stuff and they have this like super awesome skill. It's right now, it's just a feature that can be there, and it's not necessarily indicative of anything specific. We have the possibility of collecting a lot of items. I always ask about collections. Sometimes those collections can be so important to them. It kind of goes with the intense focus. You know, sometimes it's related to a certain topic. It wouldn't be unusual that I would hear, well, my child loves, fill in the blank. It's a TV show, it's a movie, it's a video game, it's something that they have a ton of memorabilia for, and they collect items related to that and can tell you everything about it, maybe even down to which episode that particular character appeared. So as I just mentioned, the media and the entertainment obsessions, becoming fixated on a certain show is possible. It may not be a certain show, but it may be a certain YouTube channel. It may be a certain show on TV, maybe a certain book series, and just really strongly preferring to engage with that rather than anything else. Our narrowed food preferences fall under restricted interest. This is a big area of difficulty for a lot of my patients. Having difficulty with foods, very specific and limited diets. A lot goes into this, the sensory piece, the preference piece, the insistence on sameness. Asking about food preferences is really important because sometimes you can have diet, you know, real problems with nutrition and diet because they are so limited. And some of these patients that I work with have to see nutritionists and therapists and their pediatrician regularly to ensure that they're getting the right nutrition and gaining weight. So that's a very important thing to think about. All right, so we talked about intense interest, and I just wanted to give you this beautiful drawing from a 4-year-old. This is the digestive system. So this 4-year-old had such an intense interest in body anatomy that he was able to draw and outline the entire system. So there's a brain, and there's a bigger brain. There's a rib cage, there's an esophagus, a stomach, a liver, a gallbladder. And I mean, if you took the time, you could probably pick out all these really important organs of the body. But like, what 4-year-old spends their time mastering this anatomy drawing, right? But this is a fun example of what sometimes these intense interests can look like. It's also a skeleton there. I wanted to talk, and spend a good bit of time on this sensory processing difficulties. I mentioned a little bit about it before. Now, sometimes the kids that I see don't have a ton in the sensory category, and that's okay. Sensory difficulties are actually not a required feature in the autism criteria, but they do fit under that big bucket of restricted interests and repetitive behaviors. I guess that could be debated, and that could have its whole a whole other webinar to discuss that. But nonetheless, this is a common feature. So I think more nowadays the sensory processing is being better understood. We still don't have a separate diagnosis of sensory processing disorder that's like really officially recognized. It's kind of commonly recognized, but I bring it up because this is such an important reason for a lot of the behaviors that we see. And I also think it's important to understand that this is a very naturally driven, these behaviors are very, very naturally driven by the body and the brain, seeking to gain sensory input or avoid sensory stimuli. And so sometimes if we're not picking up that there's a sensory issue going on, we may not understand the behavior, and we may just demand that the behavior stops, and we haven't provided the support that the child needs. Now, I use the like overreactive and underreactive categories, but sometimes we call it hypersensitive and hyposensitive. Same things. You can have a good mixture of both. Actually, you could have kids that are really sensitive to sound, but they really seek the deep pressure sensation. And so they may be throwing themselves into a couch to seek that deep sensory input. Smushing against a couch is a nice way to get some of that pressure, but at the same time, they might be averse to a whole bunch of foods, and they might be really struggling with loud noises. So they can seek and avoid sensory stimuli at the same child can do that, can do both. So common, we'll talk about some common behaviors. There is like I mentioned, the overreaction. More obvious is the aversion to certain textures. Sometimes we get in trouble with clothing. Certain clothes, certain textures of clothes they really dislike, can make getting dressed very difficult. Pretty classic to hear, well, the tags bother them, but sometimes I see it quite extreme, where the child cannot wear pants. They're wearing shorts all year round, even in the cold. They can't wear coats because the pressure of the coat is too much. The coat is too heavy, and they can't wear coats out. I've had some children like that who cannot go out in the winter when it's really cold because they cannot tolerate a coat. And it would be pretty easy to say, just put your coat on, right? But if you understand the reason behind it, that's a really uncomfortable feeling, it may make a little bit more sense and help you problem solve the situation. Sensory seeking, I mentioned the deep pressure. Sometimes they're looking for lights, they're looking for smells. I remember one I saw not too long ago had to spray the same scent in the house all the time because they love that smell and they need to smell that smell all the time. So there can be so many different behaviors that they can display. I just would encourage you to, if you're seeing this, take a step back and say, what are they getting out of this, right? Is this behavior, and maybe they're picking at things, or maybe they're ripping things up, right? Like, take a step back and look at it. Does that give them a sensation that they could be craving. Also under sensory processing falls, we can put things like motor skills and coordination in there, balance, sometimes they struggle with these skills and they need some occupational therapy to help them. And as I mentioned before, sometimes major emotional responses will happen to not getting the stimuli that they crave or being overstimulated by some kind of sensation. There can be secondary anxiety that can come from these types of situations too, where they can actually be very nervous to go to a place or to see a thing because it makes them so uncomfortable. I talked a lot about communication challenges earlier, but just so you have some examples, classically difficulty making eye contact, the nonverbal communication I went through quite a bit earlier. And this just kind of outlines a little bit more detail for you as to what these look like. Understanding social norms, this is a big one I think is often taught. Taking turns in conversation, these social, some kids are very fortunate to have some social skills support in their schools or in their therapy environments, and it's very helpful for them to understand what does that expected conversation look like? Like, how do I take turns in the conversation? What kind of greetings are used and when? So sometimes I think this is where the misconception of rudeness comes from, just not understanding what are these unwritten, unexplained rules of conversing and interacting with people. They don't naturally pick up on it, so they need some specific instruction. We talked about delayed speech development. They may start speaking later. They may have difficulty with articulation, pronunciation. They may have a very limited vocabulary. I think if there are any concerns at all about the speech and the language development, it's essential to get a speech and language evaluation. And I often refer them, even if they've received therapy in the past. I will refer them again if I think it will be helpful. Echolalia is pretty well known, I think. This is your repeating of words and phrases. It's more noticeable when it's immediate, when they're repeating exactly what you say right after you said it. But that is not every child, and that is not, you may not even see that most of the time. Also common is delayed echolalia, or they are seeing something and repeating it much later. It may be out of context. It may be a very similar context. And sometimes they use these phrases in a very appropriate way, and they actually make sense in the conversation and they're useful. And that's, but this is all part of their language development. And I think this is an important one to understand too, the literal interpretation. So I think a lot of times in the English language, we are using phrases or terminology that we say one thing and it means another thing, or it may have multiple meanings, and or we may be using it to exaggerate or be sarcastic, and they may not be able to pick up on that. And so if you find they're taking things very literally, you may need to change your language and use a little bit more clear phrases and speak more directly to them. There are more types of language, where the social difficulties and the language difficulties come together. That kind of comes out in the social pragmatics, difficulty engaging in the conversations, right? So probably the most common thing that I will see is the tendency to monologue once they get on a topic that they're interested in or wish to speak about. It can get quite one-sided, and they can talk for a very long time without interruption. And so for some, they can't have conversation at all. For some, they have normal conversation, and others, it may be something more like this, where they're talking and talking and talking without stopping. So we talked about the maintaining conversation, the back and forth, that can affect relationships and peer relations, building friendships and things. I'm trying to give you a really broad sense of, like, there are a lot of things here that affect how they interact, right? And are the reason why some of these, relationships can be stressful, and sometimes why certain behaviors occur. In the middle there, use of unusual language. Sometimes they may be using unusual words and phrases, maybe in the wrong context, or maybe maybe you kind of know what they mean, but you wouldn't use that terminology. That sometimes may be the only thing that you can detect about their language use. I put down at the bottom here that they sometimes, if they really struggle with verbal expression, there can be a different form of communication, some different kinds of gesturing, they may point, and then there are some more advanced systems available, which I don't see too much, but they're out there. The picture exchange system and augmentative communication. These are available to certain children who may benefit from these, but it's definitely not a widespread tool. I just want to end this with talking about neurodiversity. And when we talk about neurodiversity, we're talking about a really wide range of neurologic differences among individuals. And falling under neurodiversity is autism, ADHD, dyslexia, quite a few other things. That is definitely not all inclusive, but I think it's important for us to recognize that everyone is different and everyone deserves the same respect and support when they are in need. And so I just wanted to throw out there a few ways that you can support individuals who may be neurodivergent or autistic, and here they are. Educate yourself. I mean, you're here today to learn more, and I think that's amazing. The more we learn, the more we can help. Just be careful what sources you're using to educate yourself. Anything that is led by autistic adults, I tend to go to first to get opinion straight from the source. You can promote awareness wherever you are. You can advocate for inclusivity. A lot of what we end up doing, just by the nature of being a psychiatry practice, is to advocate for our children in their environments to get the support that they need. And more things that you can do: avoid stereotyping, listen, empathize, create inclusive environments wherever you are. Seek to provide resources. If you are in a position to help families and help children or adults with disabilities, and you have the ability to connect them to resources, that is so needed. And encourage self-advocacy. One of my favorite things to do is to work with kids to stand up for themselves and advocate for their own needs, because they are not always going to have someone standing right next to them advocating for them. And so if I give a lot of praise if they're able to say, hey, that's hard for me right now. Can you help me? Or advocate for their needs. Celebrate diversity. In autism, we should not be thinking about fixing them, curing them, eliminating this from the genetic pool. I mean, I've heard all kinds of things. Just it's very sad. You know, we do need the diversity. Some of these people have made tremendous contributions to society, and so we need the diversity. And in your environment, lead by example. Others will follow you if you are compassionate and you're helpful. Okay, I think we're ready for questions. And we'll try to answer some. Also, they're only seen by us and not the whole group. So you can ask whatever you would like, and I will try to get to it. If you have questions that you don't want to bring up today, but you have some burning questions, then please email them. I'll put the slide back up for our email address if you would like to reach out. autism@medpsychnj.com. Okay. Okay, so one question. Will future webinars provide strategies on how to help our kids navigate the world, given all these challenges, and especially for teenagers? Yes, our plan is to do more of these in the future. We certainly do this day in and day out. And, you know, while there's so much to cover in terms of just like what autism is, I wasn't able to get into that today as much as I wanted to. But yes, that is actually one of the next topics that we will cover on autism. There are a lot of challenges and how to navigate, you know, some of it depends on what the age is, and some of it depends on the situation and what's available, what resources you have. But yes, we need to address all these things, and we could definitely get into a full webinar on navigating the social challenges, for example. Yes, so please stay tuned. We will have more webinars coming out as time goes on. I think, you know, a question I'm going to answer that we get a lot is, my child is showing some of these signs. What do I do? And should I get them diagnosed? And I especially get this question with the older teenagers, you know, the adolescents. If you have a concern and you're not sure, it is absolutely a really important thing to have them evaluated and try to understand what is going on, because a lot of problem solving depends on the reason for the problem. And, you know, I do have some teenagers who respond really well to getting a diagnosis and finding out that, wow, all of this makes sense. I have had so much trouble in my life making friends, dealing with this thing, dealing with that thing, and now I have a reason for it. It's not just me doing everything wrong. And I think that, you know, if the question is there and you're seeking help for your child, you should get them evaluated. Another question: at what age is it possible to confidently distinguish between autism, ADHD, or sensory issues? That's a really great question. Autism can be, I mean, there are studies looking at autism down to like a couple of months old and how they interact with their, you know, with their parents, and what kind of response they give and what kind of eye contact they make. And, you know, supposedly it's pretty reliable, even down to like a few months old, what they can detect. But practically speaking, you have to remember you are dealing with a brain that's developing, and that brain is developing all the way to 25 or even 27, possibly. So a lot is going to change over time. ADHD can sometimes be really evident quite early on, especially if there is hyperactivity. But in attention type of ADHD, you may not pick up until later. Sensory issues you can have with ADHD, you can have sensory issues with autism, and it's being debated whether that is its own diagnosis. So I would say on average, most of the families that I talk to, there are some pretty clear signs, definitely by age 2, that there is something different, and there are some challenges. Distinguishing between autism and ADHD, I think that what you're trying to ask is, how do you distinguish what is attributable to which diagnosis, which is a really hard thing to sort out because there is overlap. And if you're seeing that really early strong hyperactivity by 3-4 years old, I think by 4 you may be able to discern whether there's ADHD there. Autism may or may not be that obvious at that age. Sometimes it's obvious very early, and sometimes a lot of the evaluations I've seen lately are teenagers, and we don't know. So there's no correct answer to that question, but it depends on the child and their presentation. It helps so much if you're following. If you see something different in your 3-year-old, that you start following with somebody who can track these things, whether it's developmental, it's your pediatrician, it's your child psychologist, whoever, someone who knows a bit about these things, right? To be able to start tracking and monitoring, because if I have history back to 2 years old, and I have a speech language evaluation, and I have a little like summary by a preschool teacher, it's so much easier to make a diagnosis and distinguish between the two, the more information you have. So that would be my advice, is that, track these things, and it helps us tease it out much earlier. Yeah. We have about 2 minutes left. Any thoughts? Maybe you don't have a question, but you have a thought, even feedback about this presentation. I would love to see any feedback. I apologize for the screen not being there earlier, but it was really just like an intro, a couple of intro slides, so we'll get the hang of it. Okay. I'll give 2 more minutes for questions. Okay, I don't see any more questions, so we will wrap up, and I hope you all have a great day.